Hi everyone, Dr. Tom Cordier here. I hope everybody's doing great today. I want to talk to you today about a very important topic, and that is why mental health treatment doesn't work for a lot of kids. And the reason being is, first and foremost, parent involvement. It lacks parent involvement. And the first scenario I want to talk about very briefly is talk therapy. Talk therapy is the traditional therapy that most people receive when they go to get mental health treatment. And talk therapy is when the patient speaks about their problems or their past situations and their issues, and the therapist kind of validates what's happening and shows empathy and kind of gives them a pat on the back and tells them everything's going to be okay. And they go back the next week and they talk some more. And this could go on for months and years. And it's good to a degree because it helps people get things off their chest and it helps them figure out why they're where they're at now and basically what's going on in their life. The only problem with that, though, lies within the fact that the more we commiserate, we talk about our problems, the worse we feel. And what that does, it actually deprives our brain of proteins and molecules it needs to learn both thoughts and emotions. And there's been numerous studies within the last 2 years that validate that. Now, what I do is cognitive behavioral treatment, and that is really learning certain skills to be able to change our process and change the way we think. I've taken it a step farther. I base my CBT model on neurology and the biology of the body and how the brain and body works together. I call it neuroemotive cognitive behavioral treatment. Basically, how it works is we learn everything in our life through experience, through repetition. That's how you learn to play guitar, right? You play and you keep playing. Eventually, your brain wires itself for a guitar. When you stop playing, say you take a break for a year or two, your brain goes back to the same old pathway, the one it knew before. The repetition, the repeated cycles it used to do, maybe lying on the couch and playing video games, right? The repetitive behaviors, the repetitive thoughts, feelings, and behaviors it's used to. So the guitar has to be learned all over again from the beginning. It works that way with everything, from studying for an exam to learning how to dance, to learning a language. That's why when kids first learn languages at a young age, they're more apt to learn it quickly, more precisely, and they have it for the rest of their life. However, if they stop around the early teenage years, they lose it. They have to learn it all over again. So it's use it or lose it. With CBT, what we're doing here is we're repeating the skills, if it's done right, repeating the skills over and over and over and rewiring the brain to think a certain way. We're actually building those neurons and building those proteins so people can see things differently and change the way that they see themselves, the way they see the world. You see, so the way we think is based on our experiences. So all the things that have happened to us in life, right? The way people have treated us, the things we've learned to do, such as drive a car, play guitar, all these things kind of are wired within our brain, right? If we stop doing it, we kind of forget about it. What do kids do the most, though? What kids do the most is they tend to, at least lately, they watch a lot of video games. They tend to, they're doing a lot of things that really aren't healthy. So they're wiring their brain that way. Now, we learn a lot of the way we look at the world and a lot about ourselves, hence our behaviors are formed based on the way that we're parented. So these experiences keep getting repeated over and over. In other words, the relationship we have with our dads and our moms, right? These things, these little things that happen, right, are shaped. They shape the way that we see the world and the way we behave. Now with CBT, what we're doing is teaching people a new way to see themselves and the world and to react. If a child or a teen learns these skills, it's a wonderful thing and it sure as heck is better than nothing. But that child is learning this, or that teen, without parent involvement. They're put back into their household, they go back home, and what happens? the same old parenting techniques and styles that their parents are used to. So they're out there trying to fend off from basic irrationality, from these different situations that are happening, and trying to step back, use their skills, see the things clearly, remain calm, say to themselves, geez, it's my parents, are just, they mean well, they're doing the best they can. I'm just not gonna react, not gonna get angry, let things, just take their course, and I'm gonna either talk to them kindly or, rationally, or I'm gonna kind of go up to my room, right? So if the parents aren't involved, that's what happens with the kids. However, if the parents learn the same skills that the kids learn by attending my once a week, 8-week workshop for parents. It's called PET, Parent Empowerment Workshop. The parents learn the same skills, so they can not only calm their household down, calm themselves down through repetitive learning of new skills. They see the world differently. They feel calmer, they react differently. Then parenting becomes more about getting the behaviors that are better for their child, that'll work better for them so they succeed in life, better for the parents so they get the behaviors they want, and it maintains status quo within their home. So if they learn it, they learn to parent better, to reinforce better, how to use proper techniques. And it's really a kind of a marriage made in heaven, because both sides are getting these very, very crucial structured skills that are actually a lot of fun to learn. And they're also plugging in, especially the kids, plugging in their own problems and talking about them, but being able to do something about those issues, to solve them, instead of just commiserating every week. So that's the difference. When we learn a new way to think, we actually rewire our brain. But parents are there to make sure the repetition keeps going. Because if you don't keep repeating the skills, just like playing the guitar or anything else, you lose it and you have to learn over. So CBT is a methodology, or neuroemotive cognitive behavioral treatment is a methodology for the here and now, but something you take with you for your entire life, providing you continue to repeat these skills over and over. And once people graduate from my program, they are free to come back. They can come back anytime they want. They are welcome to come back, and they can get what I call a tune-up on CBT to learn it, to kind of brush up on these skills. But however, they have the skills and they keep doing it, they get better and better at it throughout life. And the parents are there for a spell to reinforce these skills and to make sure that they're doing them. And the parents are doing it as well. So it is, like I said, it's a win-win situation, and it's new therapy, new treatment for a new age, because times have changed. So stay tuned. We're going to be doing some more videos on how the brain actually rewires itself for video games and different things that our kids do, and how that basically happens and why it's so hard for them to learn a new way. And of course, that's where we step in, you as parents, me as a provider, as partners, to make these good changes, these rationally positive changes for the better. All right, take care. Have yourself a great day, a great rest of the week, and I look forward to seeing you soon. And till then, have a good one.